healthresourcedirectory.org.au. Patient Fact Sheet. Sexual health screening. What is it? Sexual health screening is testing for one or more sexually transmitted infections, STIs. You might need a screening test if your GP thinks there is a risk you could have an STI. Not all STIs have symptoms, so even if you are feeling well, it's important to test if you think you may have come into contact with someone that has an STI. Different types of STIs. Chlamydia. Chlamydia is a bacterial infection that often doesn't have any symptoms. Hepatitis A, B, and C. Hepatitis A, B, and C are serious liver infections caused by different types of the hepatitis virus. Gonorrhea. Gonorrhea is a bacterial infection that can lead to infertility if it is left untreated. Syphilis. Syphilis is a serious bacterial infection that starts as a painless sore. Genital herpes. Genital herpes is an infection that causes genital pain and sores. HIV. HIV is a virus that affects your body's ability to fight infections and progresses to AIDS. What will my GP do now? Your GP will tell you when you need to come back in to have your screening test. Your GP will also give you information about different STIs, tell you when you need to have the screening test, explain what the test involves, discuss which STIs you may be at risk of, get your consent before doing any testing, work out whether you have a higher risk for some STIs, give you information about STI prevention, talk to you about contraception. What will my GP do in the future? As soon as your test results are ready, your GP will phone you to discuss them. Your GP may ask you to come in for another appointment to discuss the results and any treatments you may need. Your GP will also give you information about the treatments for your STIs, talk to you about when and how to tell your previous partners. This is called contact tracing. Talk to you about safe sex and STI prevention in future. What can I do? It's normal to feel worried or scared. Remember, your GP will support you throughout this entire process. It's important to arrange your test sooner rather than later. The earlier you find out, the sooner you can start any necessary treatment and prevent any disease from spreading. Here's what you can do now. Book an appointment with your GP to have the screening test done. Talk to your GP about STI prevention and contraception. Stay calm and try not to assume the worst. What supports are available? Liverpool Sexual Health Clinic. The Liverpool Sexual Health Clinic offers private STI testing and diagnosis. The clinic also provides medication if you are or may be at risk of HIV. This medicine, called PEP, PEP, may prevent HIV if taken 72 hours after potential exposure. As well as helping you with contact tracing, staff can help you manage and cope with your STI diagnosis. You can either ask your GP to refer you or contact the clinic directly. The address for the clinic is ground floor, 13 Elizabeth Street, Liverpool. Phone 9827 8022. What questions should I ask my doctor? What STIs could I have? Why don't I have any symptoms? What happens if I don't take the test? Will anyone find out I need the test? What happens if I test positive? How long does it take to get results? If I find out I have an STI, is it curable? This information is to be viewed by someone who has received a diagnosis from their doctor. It is not designed to be used to diagnose a condition or as a substitute for ongoing medical care. Health Resource Directory fact sheets are endorsed by South Western Sydney PHN's Community Advisory Committee and local GPs.